spironolactone. So at a dose of 25 milligrams a day, the spironolactone acts as a potassium-sparing diuretic and it blocks testosterone. You don't get an androgenetic effect until about 50 milligrams. So you really don't want to dose any less than 50 milligrams if you're using it for the purposes of controlling acne and reducing the sebum production. So the normal dose of spironolactone would be between 50 and 200, and can be dosed with oral contraceptive pills as well. The oral contraceptive pills, such as the Spironolactone, will be essentially an equivalent of adding in 25 milligrams of spironolactone. And it results in up to 85% reduction of acne, particularly on their doses of 100 to 200. That has been shown to be the case, and also particularly if they're combined with oral contraceptive pills as well. So the other benefits is because the sebum production is reduced, it reduces seborrhea, and it also has been shown to improve hirsutism and also improve androgenetic alopecia. So for a patient that's experiencing those other potential androgenetic effects, they will get that additional benefit in addition to their acne. The decrease of blood pressure is often seen as a benefit to patients. The mean reduction is about 5 points on the systolic and 2.5 on the diastolic, so it is a very slight reduction. Common side effects to make patients aware of would include breast tenderness, menstrual irregularities. This is particularly true for high doses and when they're not using oral contraceptive pills. And then also headache and fatigue, dizziness. And then there is some hyperkalemia that is a concern, and this is often something that dermatologists will ask about. So in terms of the monitoring that's required, and the reference that I'm referring to here is from when I was the co-editor-in-chief of the International Journal of Women's Dermatology. Dr. Schlosser and colleagues developed an excellent review on this topic to look at all of the literature. So they showed that it's important to check a potassium at baseline and then 4 weeks into therapy. And this is only true for patients that are greater than 46 years of age, so an older patient on spironolactone. If they have any cardiac renal disease that is known, or if you are using concomitant drospirenone at the same time with the spironolactone. And it's important also in terms of women of childbearing age to remember that spironolactone has been reported to be a pregnancy teratogen because it can cause hypospadias as well as feminization of a male fetus. So this would not be a therapy we would recommend continuing in the first trimester of pregnancy. And there is a black box warning regarding benign tumors in animal studies. But the origin of this is important to keep in mind. So this was studies in rats at high doses of 150 milligrams per kilogram per day, which is an incredibly high dose. And it showed hepatocellular adenomas, testicular interstitial cell tumors, thyroid follicular cell adenomas, and carcinomas. There have been no mammalian in vitro studies that show any kind of mutagenicity, and there's also no evidence in humans. It actually has been shown to decrease the risk of prostate cancer, and there was no association with breast, ovarian, bladder, kidney, gastric, and esophageal cancer. So there's a black box warning for a reason, but it was at extremely high doses just in animal models.